Hi everyone, and welcome to this presentation on the Snot Squad. This is a presentation for fosters of the San Jose Animal Care Center, and we'll have specifics for our foster program. However, this is great general information for anyone who is fostering kittens. In order to get credit for this course and to foster your first URI kittens, you will need to watch this video lecture, review the squad manual, watch the remainder of the YouTube playlist, and then pass the quiz. Members of the Snot Squad take care of kittens that have upper respiratory infections, also known as URI. This causes a classic head cold presentation, which results in sneezing, runny eyes and nose, and it's one of the most common diseases we see in the shelter, especially in our kittens. By fostering URI kittens and joining the Snot Squad, you are helping out the shelter immensely by keeping the URI wards empty. So thank you. Let's start off with the basics. URI is effectively a kitty cold. It can be caused by many different things, most commonly viruses such as herpes virus or calicivirus, and less commonly, it can be due to bacteria. Quite frequently, cats can have multiple viruses and bacteria circulating in them, so we often do not know the actual cause of the cold. Luckily, the treatment for all types of URI is basically the same. Herpes virus causes the vast majority of upper respiratory infections in cats and kittens. Mom passes on the herpes virus to her kittens because she is stressed from the process of giving birth, being pregnant, potentially malnourished, and living out on the street. When she's shedding the herpes virus, she passes it on to her kittens, who have a weak immune system because they are newborns and have never had a virus attack them before. And these kittens may also be under stress from malnutrition, concurrent parasites, or other issues happening in their environment. Because we know that herpes is activated by stress, it's no surprise that lots of cats and kittens coming into the shelter have herpes virus URI. URI is spread between cats through the discharge of the nose and the eyes. This basically means their sneezes, their snotty noses, and their eye boogers. These are all full of virus particles. So when kittens snuggle together or snuggle with their mom, they're going to be swapping viruses and bacteria. You can also be spreading URI if you have snot or boogers or sneeze particles on your hands or clothes and then touch other kittens. The URI viruses cause damage to the eyes, nose, and mouth, leading to our classic head cold signs: the sneezing, red puffy eyes, discharge from the eyes and nose, and nasal congestion. Viruses can also cause ulceration. Most commonly, you will see ulcers of the eyeball or of the tongue or roof of mouth. In severe cases of upper respiratory infection, this can lead to kittens with poor appetite, fevers, lethargy, dehydration, and in the worst case scenario can lead to pneumonia, which is a very serious complication. What happens with pneumonia is that effectively our head cold has now become a chest cold, and we have severe secondary bacterial infection in the chest. These kittens struggle to breathe and require lots of antibiotics and TLC. Luckily, most URI remains mild and is treated simply with supportive care and maybe some antibiotics. Moving on to treatment for upper respiratory infection, we're going to focus on supportive care in addition to antibiotics. The first thing you're going to want to do is to create a healing environment for your kitten. We want to make sure that our kittens are in a low stress environment. This means we're going to want to put them in a nice quiet bathroom or quiet bedroom, especially if the kitten is shy or fearful. We don't want to keep them in a busy living room where everyone's running around and making noise all the time. These guys have a cold, so they need to rest and sleep. Babies already sleep a lot. These guys are going to need to sleep even more. We are going to want to make sure that our babies have a heating pad or heat source and that they are kept warm and humid. So if you have a playpen, that means potentially covering up with a towel to help keep the humidity inside. Check to see where they are sleeping, to see if they are curling up on the heating pad or if they are choosing to lie spread out off the heating pad, which can be a sign that they are either too hot or too cold. Next up, we're going to want to keep them nice and clean and prevent reinfection of the virus. We're going to do this by using a cotton ball or warm wet washcloth to wipe away the gunk from their eyes and nose. Your goal is to keep your kittens lovely and clean If your kitten's eyes are severely crusted, you're going to want to warm up that compress and press it on the eye until you're able to peel that eye open. Don't be surprised if you get a pus volcano like in this picture. Here's a really great video about opening up pussy eyeballs and how to take care of all that goo. After you've gotten all of the infected material out of the eyeball, you're going to want to apply antibiotic eye ointment. You can do this either using your washed fingertip, a Q-tip, or you can apply it directly with the tube. There's lots of techniques for how to do this, so here's a couple of videos down below. The more frequently you can apply it, the better. We ask that you give your eye ointment at least 2 to 3 times a day, which is every 8 to 12 hours. But if you can do it more frequently, or if your kitten needs it more frequently because they have a lot of buildup, please go nuts and use up that eye ointment. In some cases, we also are going to be prescribing oral antibiotics for your kittens. It's really important that you read the instructions for your particular antibiotic, since a lot of these need to be kept in the refrigerator, shaken well before given with a meal, and if you have any questions, contact the shelter for clarification. Watch this awesome video below for how to give medications to kittens. And in many cases, you will be giving both types of treatment, eye ointment and oral medication, because these babies don't have a strong immune system, they're often skinny, dehydrated, have had poor nutrition and heavy parasite loads. They're really going to need the extra help from those antibiotics. If your kitten has any sort of nasal congestion or nasal crusting, or is wheezing, struggling to breathe, then you're going to want to invest in either a nebulizer or make them a steam bath. This basically means increasing the humidity and warmth of the air that they breathe 2 to 3 times a day for 5 to 10 minutes. We've got these really great videos about how you can make a nebulizer or how you can simply use steam treatment to help clear up all that congestion in the lungs. Using a humidifier in your kitten room can also help improve the humidity. If your kitten gets really sick, unfortunately, they may need subcutaneous fluids if they're extremely lethargic or dehydrated. In these cases, your kitten is probably also having severe upper respiratory infection, so they're going to be on all sorts of other medications as well. Follow the instructions provided for your giving fluids, and check out this really awesome video about how to give fluids. In addition to monitoring your standard parameters such as appetite, activity, weight, and stool, you're also going to be monitoring the signs of their upper respiratory infection, such as their discharge from the eyes and the nose, if there's any changes to the eyeball, and very importantly, you're going to be watching how they breathe. This means monitoring their breathing rate, which is how fast they're breathing, and their effort, which is how deep the breaths are. You're also going to want to listen for congestion. Do you hear any sort of gunky rattling up in their nose, or is it getting worse? Is it getting better? Because that's going to inform our treatment decisions. Schedule a video recheck for 24 hours after starting treatment. During your recheck appointment, you'll be able to ask questions about medications, get an idea about prognosis, and then schedule additional follow-up appointments as needed. As long as your kitten is doing well and improving, you do not need to return to the shelter for a follow-up. You're going to want to complete your full course of antibiotics as prescribed, so even if your kitten is looking better, don't stop the antibiotics. And of course, at any point, if your kitten is not improving or if you are concerned, let the shelter know ASAP so we can get them a different treatment plan and answer your questions. If your kittens are still in the quarantine period and they have upper respiratory infection, continue quarantining them per usual. If your kittens have passed quarantine, there is no need to isolate them and they can run around the house having supervised playtime as usual. Now, the reason why URI kittens are different than diarrhea or ringworm kittens is because URI is not going to be highly contagious to either your pets or to other kittens that you bring in afterwards. The URI viruses are easily destroyed with basic cleaning and disinfection, and most cats already have herpes virus, so you're not going to be spreading herpes virus from your foster kittens to your personal cats. However, there are some flavors of URI, such as calicivirus, which are contagious. So if you have foster kittens with upper respiratory infection, be aware that if your cat develops an upper respiratory infection, that is most likely due to their own herpes being reactivated from the stress of having kittens in the house, and that it is possible that your kittens have brought in calicivirus, which actually is contagious to other cats. Calicivirus tends to be a very fast onset fever, lethargy, limping, and then occasionally sneezing, runny eyes and nose, and classic URI signs. If you want to be extra safe, isolate your kittens with upper respiratory infection just like you would for any other contagious disease. Well, that was a whirlwind. We just went through so much information so quickly, so please feel free to watch again. And I really recommend you guys check out this video from Maddie's Fund. It's a great summary of upper respiratory infection, and it covers a lot of what we covered, but in a different format, which can be helpful for learning. All right, guys, you have finished this video lecture on upper respiratory infection. Next up, I'm going to want you to review your squad manual, which you can download on the website, which has notes from this lecture and summarizes everything you'll need to know about taking care of your URI babies. Watch the rest of the YouTube playlist, which basically is all the videos that I linked in this presentation. This will give you examples of how to perform some of the technical skills that you'll need to take care of your URI baby. And finally, once you feel like you reviewed all the information, take the squad quiz, and once you pass, we'll hook you up with some monsters. Thanks so much for watching, and we'll see you next time.